Welcome. Doctor, my stool is white. Is this dangerous or not? In this video, we'll talk about white stool and other abnormal stool colors. We'll also discuss what to do if this happens and what each color signifies. We previously made videos about black stool and discussed its causes and implications. But today, let's talk about all the strange colors that can occur in stool and identify which are dangerous and which are not. We'll also talk about using certain medications when stool is green. Is that right or wrong? Let's get started. To start with, white stool. White stool occurs when there's a blockage in the bile ducts or an effect on bile production. This isn't normal or natural, whether it happens in the elderly or in young children. Its significance isn't extremely dangerous, but it does require action. So when we see white stool, we should immediately see a gastroenterologist or a pediatrician if the patient is a young child. The doctor will usually order a number of tests to help rule out or confirm if there is a problem in the bile ducts or with bile production. Based on those results, the treatment plan is then determined, whether it is surgical or medical. However, white stool is a sign that requires attention. Okay, doctor, what about green stool? The green color of stool. Many of us have seen it. Those with a newborn might see it in the first week of bowel movements. Sometimes we see very dark black stool, and sometimes it's green, and other times in children or adults. It happens with gastroenteritis, not all cases, but some of them. It also happens sometimes with the use of antibiotics. Green stool isn't a danger sign, rather it happens due to things in food and drink. It happens because of digestive issues. It happens due to antibiotics and in small babies, so it doesn't raise a major red flag like white or black stool. Besides these two colors, here's a quick summary of black stool. 2. For those who didn't see the previous video about black stool. Black stool is a very strong warning sign because we must rule out blood coming from the upper digestive tract. People who have stomach ulcers or duodenal ulcers, sometimes blood comes from the upper half of the digestive tract, or in those with esophageal varices, God forbid. When blood is shed, by the time it passes with the stool, it has turned black. Are there normal things that cause black stool? Yes, of course, medications like iron tablets, iron capsules, or vitamins containing iron, even multivitamins. It also happens with charcoal tablets and with certain foods like liver, beets, and other foods high in iron. Black stool is also one of those things that requires attention. So now we have two types of stool, or two colors of stool. We must stay focused. If it happens, we go to the doctor. Okay, what if the stool is white? What if the stool is black, doctor? Some people use intestinal antiseptics like streptoquine, for example, or Flagyl, for example, or Septazole, for example. Of course, these are antibiotics, but it's common among people that when there are abdominal symptoms, they take them on their own. These medications can turn the stool color green, and I want to tell you that this isn't the healthiest thing because these are antibiotics. And most of the time, when we have, for example, diarrhea is most often caused by a viral infection, so the antibiotic doesn't see the virus and doesn't work on it. But all you get from this is that the antibiotic caused the beneficial bacteria in your digestive system or in your intestines to be expelled with the stool, and that's not healthy. So what should we do if this happens? Or if you've taken an antibiotic like this and watched the video and realized you shouldn't take antibiotics this way, it's best to take any natural probiotic like yogurt, for example. For people who like yogurt and aren't allergic to it, you take a cup of yogurt like that once every day for 10 to 14 days. Okay, so now we know about green stool color. What will we do? White stool color. What will we do? Black stool color. What should we do in this situation? Okay, doctor, I noticed there is a distinct red color in the stool. The presence of red really makes us worry about the possibility of live blood. We call it live blood because it's coming from the lower half of the digestive system. And for this, we absolutely cannot wait at all. For this, we head immediately to the nearest hospital or the nearest clinic. If you are following up with a specific person, the blood that comes out in the stool, if the amount is large, it affects our vital signs and can cause other problems. If it's a small amount, it doesn't scare us much, but action must be taken. Most of the time, the action is a clinical examination and a clinical inspection of the anal area to rule out hemorrhoids and anal fissures. And sometimes a proctoscopy is done so that we can see what is bleeding from the digestive system. So we've learned about black, white, green, and red as well in the stool. We've received questions lately about black stool only, so we wanted to also gather the different colors in stool analysis. We talked about how we'll act in each of these situations. We talked about the use of antibiotics that affect the intestines and beneficial bacteria. How will we deal with them? So, overall, to summarize the important information in a message, if anyone's stool nature changes, whether it's the color or its consistency, and it's a clear change, This means you must inform your doctor, get their opinion. Even if you call them first, tell them what's happening, and they'll tell you to come in or do a specific test and then come to the clinic. Why do we do this, everyone? We shouldn't keep self-treating in these kinds of situations. Because sometimes people have black stool and they come to our clinic quite often. When we ask if they have black stool, they say, "Oh, it's been happening for 3 months. I thought it was just from food." But it turns out they aren't eating anything that would turn their stool black. So let's be careful. If something happens, tell the doctor and they'll tell us what to do. I want you to write to me in the video comments. If anyone has experienced an unusual stool color, let us know so we can answer your question in a video. Also, write your questions about the digestive system in general, not just about stool. We'll be making a new video soon about different urine colors, not just stool. Because some people want to know what to do when their urine color changes, God willing. See you in the next video. If our information is helpful to you, don't forget to subscribe to our channel. Don't forget to share the video if someone could benefit from this information. And don't forget to like the video. See you in the next video, God willing. Peace be upon you.